What's up, everyone? I'm Michael. Welcome to the Reform HP podcast. I am back with my favorite guest, and because this is my second episode and he has been on both of them, my only guest, Miguel Aragoncillo from Boston, Massachusetts. Miguel, we are going to pick up where we left off with episode one. I said that you bring the pitchers and I'll bring the kickers. So this time we're going to dive into some more specific athlete cases.
Yeah,
Baseball players, you work a lot with football players, especially kickers and punters I work with. And we're going to get into how the principles of PRI and functional range systems inform the way that you work with more specific athlete populations. Uh,
definitely.
but, but first, Miguel, I'm sure it's been a couple weeks since our last podcast,
Yeah.
and I know you're a big food guy. So when I finally make my way up to the Northeast, what is if I only get to go to one restaurant in your area? What is it?
One restaurant in Boston.
Yeah, you get one.
That's
You
a
get
big,
one shot. You get one shot to persuade me to come back up north again.
I would have to say a bunch of Italian foods are the big draw for Boston. You're not going to
Okay.
be like, oh, I really like, the Indian food in Boston. It doesn't really make sense to that.
Okay.
Um, any Italian foods in the area, it's like a big, big draw for sure. So
Okay.
honestly, anywhere is really good. There's a lot of good places. I'm sure I'll get some flack from that from whomever, but I'm not going to be like fancying like an Asian restaurant in Boston. I'd go somewhere that makes solid Italian food.
Well, I
So
saw I saw some of our I say our colleagues as if I'm as
yeah,
close to them as you are. Your colleagues were on a food tour that you missed out on in Chicago last week, so I'm sure that
yeah,
was
Chicago's a
I'm
little
su-
different. Yeah.
I'm sure that was heart wrenching for you to miss out on that experience with them. But anyway, yeah, let's dive into the good stuff. Picking up where we left off last episode, have you worked with any kickers and punters?
Not the top of my head. I probably have, but I just can't remember.
Okay. Cool. But you have a pretty heavy baseball population, correct? Okay.
Yes.
Well, so for those who are new to these acronyms that we talked a lot about, PRI, FRS, postural restoration institute, functional range systems, will you give a brief summary of what Postural Restoration Institute, what PRI is? And I know that's a loaded question. I know that
Yeah.
you can get on their website and read basically textbooks, and they have tons of seminars. But if you could distill the principles of PRI into a brief summary to introduce it to someone with a just kind of a street level knowledge, how would you do that?
Well, the first sentence in my head is obviously not street level knowledge. Street level knowledge kind of implies they don't know anything about anything. So
Let's say active population, someone who's in gyms working out, but isn't diving into PubMed on a regular basis.
for sure, yeah, I was
Yeah.
on PubMed last night. Um, what happens is as we grow and develop, there are neurological and biological things that happen within our body and uh, inside of ourselves, inside our brain, that determine certain behaviors. And based on those behaviors, you're going to have certain outcomes. And from that, you have certain movement outcomes. So based off of that, you would have different patterns that emerge based off of these patterns. And these outcomes will either be deleterious or will be problematic for general baseline level of health or higher levels of performance, right? There might be some limiting factors or roadblocks in the way that prevent some individuals from performing at a high level due to these roadblocks that are inherent in each human organism. So that's basically what it comes down to. To make it really, really easy, there are things inside our body and things in our brain that we become kind of patterned to. And these patterns kind of stop us from higher levels of performance and just general baseline levels of health.
The biggest distinctive I think PRI has brought to the fitness therapy landscape is the idea of asymmetry. And typically when you get into this world, you get into corrective exercises, strength training, and everyone's about correcting asymmetries. Asymmetry is synonymous with bad. Asymmetry means you're on a trajectory to injury, overuse. So we got to balance out the asymmetries. Whereas PRI is the first, and I don't know of another school of thought that really stakes that claim of the human body is fundamentally asymmetrical neurologically and anatomically. And that is the fundamental piece. If you don't have that, then you don't really have most of the things that make PRI distinctive. So how would you respond to the objection that I've heard from multiple people, a lot of high level people, that PRI, well, yes, the human body is asymmetrical. We can look at the diaphragm, obviously, but PRI makes too much of those fundamental asymmetries and is too quick to label people, is too quick to categorize people into certain patterns. To the objection that PRI makes too much of that fundamental asymmetry, and it is too small of a data point to base an entire treatment or training thought around. How would you respond to that objection?
Well, I would look at certain populations. It comes down to certain populations of individuals. Oftentimes, if individuals, populations, and who does a person work with? Not saying that if you only work with an asymmetrically minded population, such as athletes and other individuals, that this is the thing that you need. But if you're making the counter argument then that asymmetry doesn't matter, well, I have to argue, are you working with just like everyday folk that don't really do anything in their day to day, and they just happen to be, aging through their lifetime, and then now like their knee hurts, and that's the only thing that bugs them? It's like, yeah, but you wouldn't have any focus on asymmetry if the only thing you have is a knee that has a little bit of pain because you've been alive for 75, 85, 90 years. I'd assume you didn't have any issues because you did just about nothing. Not saying anything wrong with that, but you don't have any instance to have an urgency to learn anything beyond, the things that you know. Mm-hmm. There's no urgency to learn more beyond whatever you're currently learning. So, you're never going to learn beyond machine level exercises, leg extension, leg curls, hip abduction, adduction. Like if that's all you do even in your rehab, all you do is straight leg raises and all those things. If that's all you do, then that's all you're going to get, because you're not really taxing your actual like your brain. You're not learning anything new, right? Versus like you have an individual like a kicker come in. It's like, okay, someone like yourself, you have someone, when you plant your leg and then he kicks, the planted leg hurts or whatever other else happens. That problem is presented to you. What do you do then? Do you do the same level of problem solving with that? And that problem solving does not technically, or probably won't, improve the situation that you currently are experiencing. So that's kind of the counter argument there, is like, you probably just work with, the regular folks that just live life and don't necessarily have to tax themselves, right?
So there are populations who do not place so much of a demand on their body that the asymmetry management is immediately relevant.
Yeah. And that's completely valid. I mean, that makes sense. Like the population of individuals that you work with will dictate what you do with them. Mm-hmm. I think that makes sense. Now, the only thing wrong with that is we're all individuals, practitioners. We're all different practitioners with different thought processes on what to do and when certain somethings come up. What I mean by this is we all use our own experiences, and we try to limit those experiences. If you're a good practitioner, you try to limit the bias that you have, and then from there you try to follow whatever thought process you believe is the most valid, and then try to apply, whether or not you believe in asymmetry as a significant value. If not, you try to apply whatever is the best practice in your head.
The PRI practitioner, when someone walks into his or her clinic with back pain, that PRI practitioner's mind will immediately go to AIC pattern. How is this person managing or not managing an AIC pattern? That's kind of where every PRI roadmap starts. Are you in, and we probably need to take a minute to break down, well, what does PRI actually mean about asymmetry? I've kind of laid it out as there are neurological and biological or anatomical asymmetries inherent in all humans. So before we jump more into the actual management process of that, let's lay out like what is a left AIC pattern?
Yeah. So I just want to say one thing before I get to that. I think the way the courses are taught, it's first taught in what is the most digestible manner of absorbing the information. And those are presented as the primary courses. Because oftentimes it's counterintuitive to just learn everything all at once, right? Because if you were to just try to learn all the patterns from the head, jaw, neck, upper extremity, lower extremity, all those things, if you were to learn all of them all at once, you would not be able to process all that information all at once. Okay, so that's why they have primary, secondary, so on. So that's just a precursor to what your question was. The left AIC patterning deals with mostly a lower extremity focus on, it's termed anterior chain. So there's muscles on the anterior portion and the interior regions that will be pulled in a certain manner. Many times people refer to the left AIC as dumping into the right side of the body. But the other flip side of that is there's a right AIC. So what I mean by this is there's the exact opposite side of muscles. So if we can understand there's both a left and a right AIC, it's just like saying you have a left side of your body and you have a right side of your body. It's not a diagnosis. It's not a thing that you are predestined and predetermined to only have and you are stuck in it forever. It is just a simple observation based off of the assessment process that you go through. Does that make sense?
Yeah. I'm sure that in the world of Instagram fitness and rehab, you see people throwing around the terms nocebo and placebo all the time.
Yeah.
And I've seen a lot of people dismiss PRI out of hand because they will say, oh, as soon as you're calling someone a left AIC pattern, you are pathologizing human movement. And you run the risk of noceboing that person, which I think when you get into nocebo and placebo, that's really never a criticism of principles. That's always has to be a criticism of application of principles. Because I could put you in pain with a really aggressive massage, but placebo you because you think that temporary pain is creating some sort of healing outcome. So anyone who will dismiss principles based on saying, oh, you're noceboing or placeboing, I really don't take that person seriously because it's a failure to distinguish between the principles and the practitioner applying them. But when we get into left AIC, for the average person who maybe is having some back pain or has been told, oh, you have SI joint dysfunction, and that's all they ever hear. Well, what do I do about my SI joint dysfunction? That doesn't mean anything. If you can start with the premise that all human beings are biased toward this left AIC pattern, that at least gives you a starting point versus, well, if I have back pain, I guess my hips and my hamstrings are tight, so I'm going to stretch them and do some core strengthening and see what happens.
Yeah. So I think to comment on that, I think to go back to your first statement about nocebo, I've heard so many individuals, I'm sure you heard it too, of people saying, I have TMJ.
Yeah.
And it's just like, we all have TMJs. Like monkeys have TMJ, like it's temporomandibular joint. What it is there is a lack of understanding of what these names mean. So really it's an interpretation issue that leads somebody to think something is incorrect. whenever I work with somebody, I 9 times out of 10, I either just literally say whatever we're working on. Like, this is your hamstring, this is your medial hamstring, this is your, I did it this morning. This is your medial hamstring, this is your lateral hamstring. We're going to be working on something to help your medial hamstring because you're not getting enough of X.
Mhm.
I don't even use the phrasing or terminology of any of the systems that I'm working with. I'm like, this is, I did a couple, and we'll talk about this, and this might be a good segue, but I'm literally naming things like, this muscle feels a little different than this muscle. We're going to try to make this first muscle feel like the second muscle. And that's, in my mind, that's a better way to do it than actually naming whatever, because then this person becomes beholden to the name.
Yeah.
Does that make sense? Like,
yeah. Like when I'm doing the adduction drop test, I'm not telling people, hey, I am testing for your left anterior chain pattern. It's
right.
Sometimes they're wondering, they're like, why are you're putting me on my side, but you're not immediately throwing your elbow into my glute like the last massage therapist did. You're doing this as a test. And I'll say, hey, I'm assessing for your pelvis position, or your pelvis orientation. If your pelvis gets oriented in this position, you can lose leverage on certain muscles. If we can reorient your pelvis, we can now leverage this inner thigh muscle that you have trouble using. Yeah. And we can unload this glute muscle that you like to use a lot. And so if they can walk away with, like, most people don't even think about pelvis position. It's, oh, my hamstrings are tight. But if you can give people a new category of, well, are they eccentrically tight or concentrically tight? Are your hamstrings tight because they're already always stretched? And then they're like, you draw a little diagram. Hey, here's your ischial tuberosity. If the pelvis dumps forward, you've now pre-stretched the hamstrings. And they're like, oh, and you build awareness of their own body. And I think a lot of the benefit of that process is giving people a new lens through which to view their body versus the actual nitty gritty that we on the practitioner side is on the lens. Yeah. It's like, oh, I don't just have to hopelessly stretch my hamstrings for life. There's actually another more fundamental intervention that might could create a desirable outcome.
I think that piece, for any other individual who has gone through any other formal schooling, it's termed patient education, right? That kind of stuff happens whether you're going to the actual doctor, like a general physician, or ortho or anything else. You go to an individual and with some type of specialty, and you ask them, like, well, okay, what do I do now? Like, what we're doing is we work in more or less we work in the wild west. Like, there's a lot of crazy stuff that happens out there, right? So whenever I work with individuals, whether they are younger athletes or otherwise, I often ask them, like, do you want the easy answer? Very simple, like, why am I tight? It's like, your hamstrings this. Or do you want the longer answer? I've asked that simple question. Do you want the long or easy answer? Which one do you want here? The long doesn't mean it's going to be hard. It's just there's more stuff involved than your hamstrings tight.
Yeah. And you have to figure out, what is this person's learning curve? How immediate are their outcome needs? Do they just need to be told what to do? And as long as they can do the drill with my holding their hand cueing, they're good? Or do you have the people who want to dive deeper and are like, tell me about the IC adductor? Like, so that's certainly just a practitioner thing. You have to gauge the person.
Many times. Go ahead. Sorry.
I would say I have some people who I see them twice, and I say, I've taught you everything you need to be doing for yourself for the next month. If you want to come back and see me, we can dive deeper, but I'm not giving you anything else, because I need you to be religious about these 3 inputs. So these 3 inputs, I'm going to follow up with you in a month. And if you've improved, you continue improving, I might not need to see you again. Versus down here, we have Blue Cross Blue Shield insurance. Blue Cross Blue Shield has approved 24 visits over the next 3 months. And, no matter what happens, you're showing up, you're writing a copay, I'm coding, I'm getting that check. So I think we are sort of in that wild west of, as we talked about last time, there is an unprecedented Venn diagram overlapping of therapist and trainer. You have people like us who you could say we sort of hacked our way into the rehab sphere just by getting our own education and then working around high level therapists. Like we've learned from Spina and Chivers and Haruska and Cantrell and Locatelli, and all those guys they're all doctorates, or I guess Cantrell and Loke, I guess they went through PT school before it was actually done. Regardless, they outrank us in the therapy prestige hierarchy on paper for sure. But what's cool is we have access to them, and there are a lot of things that we can we can learn the most important stuff from them in a very time efficient manner. And as you know, we talked about, like, you and I are not claiming to be doctors of physical therapy, but because we spent so much time around them and because these courses are so available, it's cool that we can adopt a lot of things that at least move really big rocks. And if we need to refer out, we refer out.
Right.
Like I wish we were closer so I could refer people out to you. I know I've had people like, man, this is a superior T4. I haven't done this yet. I need to refer out. Sorry, you got to go to Macon, LA, or Boston. Those are my only guys. Yeah. Yeah. So let's get into specific athlete populations.
For sure.
I have been so eager to talk to you about the implications of asymmetries for both right-footed and left-footed kickers. And most of my PRI exposure has been myokin and pelvis. So I haven't gotten into a whole lot of the upper body stuff, which I'm sure pitchers also interest me, less from the shoulder mechanics, but from the lower body mechanics, because I see that a lot of that AFIR that would have to happen in do you call it the plant leg in pitching? Or
yeah, you can do that.
You call it the plant leg in pitching? Okay.
Lead leg.
I played one season of T-ball when I was 5, and I hated having to wear long pants in the hot summer. So I scrapped baseball altogether after one season of T-ball at age 5. So let me lay out my thoughts about, I can say kicking athletes, but these are things I've seen more with kickers and punters, and especially with kickers. Your general kicking athletes, like a soccer player, I think are going to have a lot more asymmetry management embedded in their sport. There's a lot more running, and they at least do some kicking with their non-dominant side. Even your best right-footed soccer players are going to be adequate kickers with their left foot. So I see a little bit more inherent asymmetry management embedded in the sport of soccer than I do in kickers and punters in football, because as a kicker punter, you're just doing this pretty much the same kick every time with the same side. Your sport does not require that you use the off leg whatsoever. So let's start with the PRI left AIC premise, where you have right leg, which is biased towards stance phase of gait, and you have left leg, which is biased toward swing phase of gait. Is that a fair oversimplification of the PRI perspective?
I'd say so. Yeah.
Okay.
Yeah, for sure.
And on that right side, which is biased into stance phase of gait, people tend to have better internal rotation and extension of that right hip. On the left side, which tends to be better in swing phase, people tend to have better external rotation and flexion of the left side.
Got it.
Okay. So now let's map that to a football kicking athlete, and let's just keep it with field goals for now. Punting is I think punting is less detrimental to the body than kicking. I'm sure we'll dive into that a little bit more. So if you have a human being who is naturally biased into stance phase, internal rotation, and extension of right side, and swing phase, external rotation, flexion of left side. Now take that human being and make him a right-footed football kicker.
Mm-hmm.
My theory is the right-footed kicking athlete has left AIC management inherent in his sport.
You'd think.
As a right-footed kicker, yeah, this is where it's going to get interesting, because the right-footed kicking athlete spends a lot of time in stance phase, or at least pursuing stance phase on left side, and spends time in swing phase on right side. And if you look at the mechanics of the soccer style kicker, the right leg, the plant leg, must move into AFIR as you follow through. You swing that right leg through, you have the left leg stuck in the ground as your plant, and the pelvis has to rotate relative over that fixed left leg to get through the ball. The right leg is being trained in a lot of external rotation. You open up your hip, you open up your foot to get that soccer style sweet spot kick. And as you follow through, as you fire that hip flexor, you're training flexion, hip flexion. So in the act of kicking a football right-footed, you have left AFIR occurring, and you have right ER and flexion occurring. And I also want to expand this beyond the two-step kick that you see in a game, because there are a lot of kicking drills, like a no step, for example, where you start right up by the ball. You just put your plant foot where you would plant. You don't take any steps back, and you just swing your leg and kick the ball without taking a step. It's like a warm up, kind of a skill drill for kickers. I'm sure if you've ever been to an NFL game early on, when the kickers first get on the field, you've probably seen them doing no steps. So that is what I'm very interested in, is the implications of AIC pattern management for the right-footed kicker. And I'll let you respond to that, because then what I think gets really interesting is my theory of how detrimental, or I don't want to nocebo anything. So let me take back that word detrimental. How the left-footed kicker is more likely to
be biomechanical
is more likely to reinforce the already present AIC pattern. So that right-footed kicking might be better for left AIC management, whereas left-footed kicking would be worse for left AIC management. Yeah, I'll let you, what do you think of the idea that because the kicker trains stance, AFIR on left, and swing phase, external rotation, flexion on right, that there is some inherent left AIC management embedded in the act of kicking a football right-footed?
So there's two things that come with that. The first one is, can we define what these, other than the external rotation, internal rotation, and all those things, what can we define what exactly left AIC specifically is? And in my brain, just if you were asking me this in a clinic and somebody came in and say, hey, can you tell me where I stand, quite literally, on these assessments, we would do assessments. We would see how your movements apply in a varying amount of assessments. We would do drop tests. We would do a certain frontal plane test for the hip. We would look at whether or not you can hold yourself up on one side of the table on your side, referring to the adduction lift test and those sorts of tests. We would look at all these things and try to identify where and how specifically you are embedded in these patterns. And then whether or not you tell me you're right-handed, left-handed, left-legged, whatever it is, then we can start to look at these implications of like, okay, in your everyday life, this is the second part. In your everyday life, this is where you are. When you're practicing, you might be getting into these patterns that are opposite of what is going on, which will then influence, perhaps, big assumption, will perhaps influence those assessment tests, which is the purpose of doing the assessments to begin with. Because then we can begin to see, okay, where is the compensations in this individual? Where are the tests where there's no issues? And where can we begin to improve these biomechanical efficiencies? Or rather, where do they have biomechanical inefficiencies? Where can we begin to make them biomechanical efficiencies, right? Lack of inefficiency. That's what I would look at. So specific to your right-legged kicker, when you have your left leg planted, you assume that they're getting into left AFIR. But just from what I know, athletes wear cleats. Cleats are not always beneficial to an athlete's ability to feel the ground. It's there to make them stick to the ground better. So when you plant your foot, perhaps your foot is a thing that's really sticking to the ground. You might not get enough force absorption through the rest of your kinetic chain, and there might be some things going on. You might have some issues at the ankle, at the knee, at the hip, at the back. And there might be, I don't know if you've went over this in your specific courses, but yes, you might be getting left AFIR, but what is happening at the foot on that left side? And that might be, with respect to kicking, that might be a big implication that this individual is not getting left AFIR, because just saying you get left AFIR, you also need to respect that by getting left AFIR, that means you have control of your left abdominals that are on top of the left pelvis. You are now also getting improvements on how your pelvis is on top of the femur. Okay. And then from there, you're also looking at how the femur sits on top of the tibia and how the tibia sits on top of the foot. Mm-hmm. So just by getting left AFIR, you're not getting all those different implications in the correct manner. All right.
Let me add one thing. Left side in left AIC pattern is biased toward toe off, correct?
Correct.
Right side is biased toward heel strike. So one of the things that PRI practitioners try to communicate to people is feel your left heel and feel your right medial arch. Fair?
Yeah.
If we can get a little more toe off on right and a little more heel reference on left, that's a win for the left AIC pattern management. Fair?
Say the last part again.
If we can get more heel reference on left and more inside arch toe off reference on right, that's a win for left AIC pattern management. Fair?
I'd say yeah.
Okay. Sure. So now let's take a broader perspective of the kicking athlete, not just the swing itself. Think about the approach, the drive step that moves you into the plant. The drive step, we train kickers to spring out of that right ball of foot. So we train kickers to toe off from the inside of that right foot. And as you move into a plant, you have to heel strike like crazy. If you just look at the mechanics, you can look at still frames, how they are reaching, kind of leading with that heel, almost like they're doing the most negative shin angle split squat ever as they reach for that plant foot. So also, more so than just the plant and the swing, you have a heel strike on left and a toe off on right that is inherent in the act of kicking a football right-footed.
So yes, that sounds all awesome. Honestly, I already thought of a few techniques that are very similar to that. There's a handful of standing techniques that literally do that.
Yep.
Basically, you're weight bearing on that right side, and you're teaching yourself to get onto your left. Mm-hmm. That's the basic premise there. So the differences with those two, the one I just talked about, and then the one that you're talking about, I'm going to assume is the differences of speed, how fast you do it. Because when you're kicking, you want them to be fast. The hard part is, I often talk about this, and you probably talk about this too with your clients that you're, just working on fat loss kind of habits. You have the 23-1 rule, right? 24 hours in a day. You have 1 hour that you work out and you focus on your fitness, but then you have the 23 hours of the rest of the day, right? You sleep 2 hours and then you stay up and blah, blah, blah. Like you don't sleep well, etc. Like your 1 hour in the gym doesn't really matter anymore because the rest of your lifestyle habits are not supporting that.
Yeah.
So I think of the same process of like, okay, you are working with me on this one drill for 20 minutes, and then you have a 5-hour practice or a 3-hour practice, and then you're just doing whatever you want. There's not really this, maybe let me rephrase that, not whatever you want, but you're working really hard on these other drills, maybe even in regular practice, not just talking about kickers anymore. So really you have this one drill that you should be practicing throughout your day in some capacity. Doesn't have to be 10 times, but maybe once or twice. And this is like activities of daily living. The level and speed with which you are performing this activity is very low level. It should be approached at a low level. You don't need Metallica to do these sort of Metallica or Rage Against the Machine. You don't need hype music to do these activities. When you're lifting and all these other things, like you have other stimuli to help stimulate what you're doing, right? So that's where I'm coming from. You have different speeds, you have different mentalities, you have different stimulus to help promote more efficiency, more performance, or in this case, efficiency is the lowest and least amount of energy utilized to perform at this specific thing. Does that make sense?
So
where I'm coming from is you shouldn't even need those drills as a kicker. The one that you're talking about.
What drills?
The one where you're talking about toe off to heel. Like you shouldn't need that at all. The step before the step, right?
Right. Because
that's where I'm coming from.
My argument is that the left AIC management is embedded in the skill practice of kicking.
I'm saying you don't even need that. You should be able to do the low level of PRI exercises, and then you go into kicking. The specific, like, why do you need that one drill? The I think you called it the no step drill or the step before the step. What was that one drill called?
Yeah, that's skill practice for kicking.
I completely understand. This is what I do with pitchers all the time, though, is what I'm saying. I watch what they do. I see exactly where they're at. I ask them what's going on. There are I 100% understand where you're coming from. There's skill acquisition type drills that people do as pitchers to get better rotation, to get their arm in certain positions, so on and so forth. They do like pivot pickoffs, like you kind of were just talking about. They do all these different drills to get more of something. But in reality, if we just like look at the relevant PRI information and techniques, we can extract a much easier efficiency and a much less energy needed to acquire that range of motion, so the need for even using that drill isn't even warranted. Does that make sense?
The need for the drill is not warranted from,
like, you don't even need to do it
from anything other than like I'm warming up for my kicks.
You could do whatever else you need to do for warming up, because the physiological capacity for you to understand what it means in your case of toeing off to heel strike, you don't even need to practice that. Like, it just happens. So if you're just talking about warm up to warm up, like you could technically jog. That's technically toe off to it. You know what I'm saying?
Yeah. So here's what I see with other coaches training kickers. If you have a kicker who struggles with that toe off, or if you have a kicker who struggles with that left AFIR, the solution is not to practice the kicking drill to get more left AFIR. The solution is not first and foremost, hey, on your drive step, toe off more. The solution can start with here are our PRI drills. I take you out of the crazy complex context of kicking a football. I isolate that neurological stimulus in the context of a simplified PRI technique. And then I put you back in the environment for skill acquisition. And I should have cleared those neurological roadblocks that were preventing you from finding toe off, from finding left AFIR.
You are correct with that. I would even make it easier in saying you are making the threshold for achieving, say, we'll just, I'm not sure of the exact standards that you have as a kicker for field goals, but say that it takes you all these drills, et cetera, to get warmed up and mentally stimulated to get, I do know a little bit about some of the NFL records for kicking, but 60 yards is pretty damn far for a field goal.
Yeah.
60 yards is that's pretty damn far for an NFL pro level. I don't know what it is for college. I don't know what it is for high school, but I'd say about 50 was also pretty damn far too, right?
Yeah.
So anyone understands that 50 is a far distance. Sometimes people can do it in practice, which is no pressure, et cetera, right? The other thing that we're looking at is if we can reduce the threshold for needing that mental stimulation. So when you do your drills, et cetera, you do your warm-ups, you do your PRI activities, and then in practice, you go up and you just, first one, you hit 45. You're like, what is going on? Then you start to get more mentally stimulated. It's just like warming up for lifting. It's like you start easy and then you keep on going. Then you start hitting 50s consistently. It's like, what just happened? What is going on? We've reduced the threshold for certain patterns to be, to have in terms of being a roadblock. We've reduced the need for these roadblocks to be in the way. And now all you're putting forth is efficiency. So you have this motor skill acquisition coming out because all you're doing is practicing and you're getting this clean AFIR over and over. You know what I'm saying?
Yeah. So it's interesting that we have discussed this exclusively from the PRI lens. And I'm looking at the FRS, the updated internal strength model flowchart on the wall in my office. And at the very bottom, after all the FRS inputs, at the very bottom, there's an arrow that just points down to blank space. And then in that big blank space, it says external training. So it's this idea of we are giving inputs that set the stage for desirable emergent behavior. And then that desirable emergent behavior can be molded into whatever sort of skill acquisition or external training in FRS terms that you want it to be. So I'm mapping the kind of the common language of, well, PRI, you're clearing a lot of these neurological,
patterns,
positional, neurological patterns, these positional roadblocks, such as with the pelvis. And once we have changed that, once we've cleared that, now you're free to acquire skill without those roadblocks.
Exactly.
And then FRS takes that approach from more of the strength training. And we kind of talked about how that might be sort of a misnomer for FRS. But it's a similar idea of how do we set the stage for clean skill acquisition?
That's exactly it. That's what I've been working on for so many years at this point. Because I've gotten individuals really strong deadlifting, both straight bar, trap bar, whatever people, barbell purists want to talk about, but back squats, front squats, like I've seen some pretty big numbers, and it's pretty wild just to see what athletes can do. And it's like, I'm pretty sure once you get the 600-pound deadlift, like you don't need to keep on going because it's not going to help your game. Like, is that going to get you to the big leagues? Probably not. Is being able to be strong helpful? Yes. Now the question is how much, and then how much more efficiency do you need in terms of your technical skill acquisition, right? I think the big line in the sand, if there was one, is FR speaks about things in the context of histological formation. Yes, they talk about neuroscience. I think that's a common denominator. This is all neuroscience. This is all neurology. Synaptic plasticity is a thing. Google that. It's basically how synapses are formed and how they are hardened and created and molded and how they get stronger over time. If individuals were to look at some form of cadavers, you can see that some nerves are very small and wiry, and then other nerves are really huge and thick. That is synaptic formation right there. That's synaptic plasticity at its finest. What we're looking at here is in FR, they speak more about the histological connective tissue side of things. And not saying that PRI doesn't, it does in some capacity, but it doesn't tell you now you need to train your Achilles tendon. Now you need to train your biceps tendon. You know what I'm saying?
Yeah.
That's the line, dividing line in that sand there. But at its easiest, I think efficiency is the name of the game for both realms.
Yeah. What I tell my pro guys I work with, kickers and punters, they'll tell me about their strength training program that they're following. Some of them have coaches, some of them make it up on their own.
Sure.
And if you're a Pro Bowl punter with a multi-million-dollar contract, what I'll tell them is,
not many of those.
Well, yeah. What I'll tell them is the thing that is going to take you from a 50-yard net average to a 52-yard net average is not 5 more pounds on your front squat.
Sure.
Dude, you're the top, you're in the top 30 best in the world. You made the Pro Bowl. Like, you're the top 2 in the world. Okay.
Right.
You've done weight room stuff. You went through high school, college. You've done the power cleans. You've done the trap bar deadlifts. You've done the back squats.
Yep.
Maybe at a certain level, we need pure general leg strength is going to take you from a freshman with a long of 40 to a sophomore with a long of 45. Like, there's 80% of those gains are going to occur with mostly general strength training. Become more explosive, have a little more muscle mass. But when you're operating in that top percentile of performance, that's not powerlifting, and you could probably make the argument for powerlifting. Yep. Like, if your sport's not a barbell sport, you're not trying to be a weight room warrior. It's how do we facilitate cleaner AFIR on the right side? And that's the difference in your 50-yard net bomb and your 32-yard shank. You didn't shank the ball because you didn't power clean enough. You're not capping out at a 65-yard punt because your back squat is 350 rather than 365. How do we
100% agree?
Yeah. What's a roadblock in the right iliacus? How do we, which also PRI is the only place I've really heard take the iliacus seriously, which is a particular.
There's a lot of places. Yeah.
Line. Yeah.
Oh yeah.
So I think that's a huge takeaway with when you're, like, you tying it back to the very first part of the conversation. Hey, what populations are you working with? And most of the trainers, coaches I talk with who don't see the value of these higher level inputs, PRI or kind of the specific inputs with FRS, it's like, oh, you have not had to take someone from 98 to 99%. All you have to do is take people from 20 to 40, and that's easy.
Getting somebody
from YouTube workout. Yeah.
getting a pitcher to go from 92 to 95 miles per hour, very crazy, very tough. Yeah. Going from 95 to 97, that's a multi-million-dollar deal right there.
Yeah.
And that's huge. That's huge. Yeah. I want 2 things to come across here. Really a message to you and any other practitioner who's just starting the PRI journey. There is an appendix of techniques from PRI. If you look on their resources tabs or whatever it's called, products maybe, it's a digital download now. Previously, it was a CD when CDs were still a thing, apparently. So that was a fun time. But there is an appendix. It has hundreds, and not even kidding, definitely hundreds of all positions, all techniques, sideline, supine, all 4, standing, supported, all these different movements and positions. I recommend any other practitioner to check that out, and not just like glance at it, but like look at it and start to understand why these techniques are the way they are. Like I alluded to earlier when you were talking about certain drills for kickers, it's like, oh, that's definitely a PRI technique. Like I know exactly what you're talking about.
Yeah.
Because some individuals will start to understand how they move more intrinsically, you don't gain pure left AFIR by just doing it in sideline or supine.
Mm-hmm.
Because you need to stand at some point. We're bipedal creatures. We stand on 2 feet. We're not monkeys. So we need to have the ability, no offense to any monkeys out there watching, we need to watch what we do when we're standing. So with that being said, check out the appendix. That is a plug, I guess, if there is one, but that's one piece of that. I already forget the second thing that I was going to say, but long story short, I think, sticking with these sorts of movements, that's what the last piece here is. I didn't really talk about pitchers too much, but at its finest, similarly, I think of what you're doing as you have so many steps before you take into the field goal, just for ease of use. Yeah. Yep. You don't take 10 steps and then you kick a field goal, right? You're not doing a run. Maybe that's a drill. I don't know. Running start, maybe. I don't know.
Well, a kickoffs have a large running start. Yeah.
So in any case, I think of each part. There's 6 phases in pitching. I don't know. There's probably very similar types of phases that are referred to in kicking, I'm assuming.
Mm-hmm. Yeah.
And then obviously we have the phases of the gait cycle. Whenever I'm now talking about pitching to anyone, that's a very sports specific skill. Yes.
Yeah.
Whenever I'm talking about gait cycle to any general population, there's only so many phases in the gait cycle. So I think of doing these PRI activities and techniques as a phase 0. And it's culminating into something. Maybe it'll be a product in a year or something like that. I don't know. But irrespective, I think there are specific movements and techniques that are imperative, whether or not you are working with baseball pitchers or otherwise. But terming it phase 0, whether we're talking about block 0, general fitness levels, all that. But there are certain things that you need before you go into the next 6 phases of pitching, because so many people just keep on cranking into external rotation. It's like, I need more of this. I need more of this. And so you have 130 of external rotation, but you got nothing else down low. Mm-hmm. So with that being said, like you haven't integrated your whole body, but yet you have 130 degrees of ER. How are you going to deliver that with velocity? You're just going to cause something to happen here then. Mm-hmm. Right. So that's where I'm coming from. And that's my last spiel here, my last shtick. So
that would be your input 0 in the context of FRSISM.
I guess so. Yeah.
When I asked you about that. Yeah.
Yeah.
Okay. Awesome. Yeah. Well, so we are running out of time. Yep. And I'm certain that we will do this again. Maybe we'll talk about left-footed kickers next time, and eventually we'll get to your pitchers. But Miguel, we're running out of time. What has been your favorite part of this interview?
I liked when you were talking about your kickers. That was really interesting because I don't know too much about kickers, obviously, other than rooting for them my favorite part about. I'm just thinking about other kicking events, field goal events, was when the Bears, was it? They did a double doink in the 2018 season versus the Eagles. That was pretty exciting to watch.
That got tipped. That got tipped. Cody Parkey, he got booed out the stadium. The kick got tipped. But the framing was already set that he scrubbed it. You watch the replay, it got tipped. Yes, I felt so bad for him.
It was a double doink.
It was a double doink. It was a double doink. I just felt bad that the people didn't recognize that it got tipped and everyone was just coming down so hard on him.
The moment you see it. So anyway, I like talking about kickers because it's very relevant to football and all the emotional things that come with it. So
yeah, awesome, man. Well, I appreciate you. We will do it again.
All right, man. Have a good one.
You too.